Today we will talk about a sensitive topic, medical tests after age 70. Some tests genuinely prevent disability and death. Others can create a chain of false alarms, extra procedures, and stress without improving your life. Before we list anything, here are two evidence-based questions to ask your clinician. First, what problem are we trying to solve? Screening when I feel well, or diagnosing symptoms? Second, if this test is positive, will it change my treatment in a way that improves how long or how well I live? If the answer is unclear, you deserve a clearer plan, not more testing. Important: this is not a message to avoid doctors. It is a message to choose tests wisely, based on your risks, your symptoms, and your goals. Many people online say, skip the bone density scan after 70. That is not guideline aligned for many women. In fact, major guidance recommends DXA screening for women starting at 65 because fracture risk rises with age. Here is the responsible message. A DXA scan is a low-radiation measurement that helps estimate fracture risk. But a borderline result should not automatically mean medication. Treatment should be based on overall fracture risk, history of fractures, very low bone density, and validated risk tools. About bisphosphonates, they can reduce fractures in higher-risk patients. Rare, serious side effects exist, especially with long use, so treatment duration, dental health, and follow-up matter. If your risk is lower, the plan may focus on strength, balance, nutrition, and fall prevention with clinician guidance. For many seniors, preventing falls is just as important as treating bone density. That means balance training, leg strength, vision and hearing optimization, home safety, and reviewing medications that cause dizziness. If you have mild forgetfulness that is stable, the first step is usually not a panic scan. A structured cognitive test, medication review, sleep, mood, hearing, and vascular risk factors often matter more at the start. But here is the key nuance. If symptoms are progressing, unusual, or there are neurologic signs, structural brain imaging, often MRI, can be part of a proper evaluation to look for causes that may change management. MRI also commonly shows age-related changes and incidental findings, so results must be interpreted carefully without jumping into a cascade of unnecessary tests. Seek urgent care now for sudden weakness or numbness, slurred speech, new severe headache, fainting, chest pain or pressure, coughing blood, or black tarry stools. Stress tests and cardiac imaging can be life-saving when symptoms or risk justify them. But routine just-to-be-safe testing in people without symptoms can produce false positives and lead to invasive procedures that have real risks. If you have exertional chest discomfort, unexplained shortness of breath, fainting, or known coronary disease, do not self-cancel testing. Instead, ask, what is my pre-test probability, and what decision will this test change? And remember, large trials in stable coronary disease showed that an early invasive strategy did not clearly reduce death or heart attack compared with a conservative strategy, although symptoms and individual situations differ. So the goal is precision, not fear. You may have heard stop colon screening after 75. That is not the full guidance. For many people, routine screening continues through 75. From 76 to 85, it becomes an individualized decision based on overall health, prior screening history, and preferences. Yes, complication risk from colonoscopy rises with age, and bowel preparation can be harder in frail adults or those with kidney or heart problems. That is exactly why the decision should be individualized. For many seniors, stool-based tests like FIT can be a reasonable, lower-risk option, especially when the goal is screening, not diagnosing symptoms. This is the clearest no for most asymptomatic people: whole-body CT screening. Major professional and regulatory sources do not recommend whole-body CT screening for people without symptoms because it has not been shown to prolong life, and it often finds incidental findings that trigger more tests and procedures. CT uses ionizing radiation. The dose varies by protocol. When CT is medically necessary, benefits usually outweigh risks, but just for peace of mind is rarely a good reason for a high radiation test. So here is a safer, evidence-based approach after 70. Screen when guidelines support it and your health status suggests benefit. Diagnose promptly when you have symptoms, and before any test, ask the two questions: will it change treatment? And will that treatment improve my quality or length of life? This is how you protect your health without falling into the overtesting trap.